Hello, and welcome to this presentation on how to take care of your well-being during the current COVID-19 public health crisis. This presentation was made in collaboration with the Office of International Students and Scholars under Cheyenne Lin and Aliza Irizarry, and Student Wellness under Stephanie Lynch. My name is Gabriel Fernandez, and I am a psychiatric nurse practitioner here at the University of San Diego. We are experiencing an unprecedented time in our history where social distancing measures have been enforced to address the current pandemic. These are indeed uncertain times, and uncertainty can cause stress, which can lead to anxiety, panic, and depression. That is why this quote by a USD student speaks volumes. We need to stay in the moment, stay as connected as you can, and be gentle with yourself in adjustment. Most of all, though, remember, no matter how alone you might feel, the people who love you will be there with you every step of the way. And that includes all of us here at Student Wellness. Despite the need for social distancing, we still have the ability through technology to be connected to one another. We may be far apart from each other, but we are never alone. What we will cover today is the importance of recognizing what we are feeling at this time and how to support ourselves by practicing self-care and wellness strategies, increasing resilience, and utilizing campus resources. These are some of the typical reactions during a stressful situation. Now, I would like you to go through these feelings and see if any applies to you. Are you feeling anxious or worried at this time? Are you concerned or sometimes overly concerned about your own safety and the safety of others? Do you have a fear of missing out? Are you feeling lonely or angry or ambivalent? While socially isolating, are you dealing with boredom? Were you derailed from your usual routine and were thrown off track? And lastly, I would like to emphasize these as these are very important to recognize. Are you experiencing symptoms of depression, feeling very hopeless, or are you noticing changes in your appetite or sleep? Now, we can all agree that these are difficult times, but there are many ways to take care of yourself. At a time of social distancing, there is an even greater need for social connectedness, and this is possible through the benefits of technology and social media. Go ahead and talk face to face with your friends, loved ones, and you probably already know how to do this. While it is important to stay informed, sources need to be reliable. So that means you need to check the source of the news. If it's something you've read on a Facebook post or was passed along through text messaging, you might want to verify if that information you received is indeed factual. There is a lot of misinformation, and at times, it might be best to just limit exposure to news and media coverage, especially if you are already noticing that these news are affecting you in a very negative way. When you start experiencing some of the typical reactions we have mentioned from the previous slide, it is good not to keep it to yourself and to share how you are feeling with others. Also, remember that USD student wellness resources are available for you during this time, and I will mention some of these resources towards the end of this presentation. Again, don't forget to take care of yourself. Maintain a routine and take care of your body. Stick to a sleeping routine. Don't stay up too late or oversleep. It might be tempting to stay up late, but this will affect how you perform for the next day. So like what I tell all my patients, you need to stick to the same sleeping and waking times and to stick to that schedule consistently. Also, eat healthily and avoid excessive use of caffeine, alcohol, and avoid substances. Variety is also key to battle boredom, so mix up your daily activities. Aside from these suggestions, I cannot emphasize enough the importance of daily exercise. It is not only beneficial for your mental health, but for your physical health as well, as it can help boost your immune system. Here are some online resources which you can access anonymously. You can check out this link, which is screening.mentalhealthscreening.org/USD. If you feel unsure about your symptoms and want an evidence-based tool to assess various aspects of your current mental state. However, if you do encounter something concerning, please connect with the USD Counseling Center or your personal provider. The number for the National Suicide Prevention Lifeline is listed here, as well as a link for their chat services, and they are available 24/7. Now, for students who are enrolled in the USD Student Health Insurance Plan, you are provided access with Silver Cloud Health, which contains programs designed to help students think and feel better. These were developed by clinicians and may be helpful in addressing depression, anxiety, and stress. I would encourage you to check silvercloud.com, even if you are not experiencing any of these symptoms. Now, I would like to go over this very quickly as a reminder that your wellness is multidimensional. As a human being, there are 8 different types of self-care that you need to address. First is physical self-care. Remember to eat healthily, maintain a good and consistent sleeping schedule, and get regular exercise. In my opinion, exercise is the most underutilized antidepressant. I suggest 15 to 30 minutes of moderate physical activity and 8 to 10 hours of sleep per night to greatly improve your mood and academic performance. Now, we all know that gyms are closed at this time, but there are free workouts available in the internet for streaming, and you don't really need a gym to use those. Next is social self-care. Make sure that you stay connected despite being physically distant. Spend time with others using the available face-to-face methods, or if not available, a phone call is good enough. Stay in contact with your friends as if you were hanging out with each other. These face-to-face methods have capabilities to cater to multiple screens at one time, so you can actually do a virtual hangout at the comfort of your own homes. Explore new interests and learn a new hobby. Human beings are also spiritual beings. We need to take care not only of the physical, but also the mental and spiritual. Staying at home is a good time to meditate and pray. I suggest to start your day with about 10 minutes of meditation or prayer to help set the tone for your day. The university ministry hosts live 7 p.m. gatherings and virtual mass through their website at sandiego.edu/ministry, and there are free guided meditations available online. And don't think that staying at home disables you from volunteering and contributing to a good cause. There are good websites to check out, and one of them is allforgood.org. Emotional self-care. Try writing in a journal or have a video session with your counselor, if you have one. The USD Counseling Center is still available for phone consultations, and you can book a phone appointment through your My Wellness portal. Here are other ways to manage your stress and anxiety. Grabbing something ice cold to place on your forehead is a tried and tested technique that may actually de-escalate anxiety, and panic symptoms. Deep breathing exercises may help calm you down and focus better. Distracting yourself is a technique to help get your mind from the anxious stimuli. Some people recite the alphabet or count until they feel better. Getting in touch with more positive emotion means you need to do activities that elicits a positive emotion to counteract a negative emotion. For example, when feeling sad, try listening to something upbeat or watch a funny show. Grounding yourself using your five senses can be helpful as a routine. Think about the end of the day when you are trying to relax. Some people like building a self-soothing kit. Certain scents such as lavender or chamomile can be helpful in fostering relaxation and sleep. Lastly, focus on one thing at a time and avoid overwhelming your brain with multitasking. Think of your brain as a computer. Once you open a lot of programs or applications at one time, you'll notice the whole thing slowed down. That means you need to close unused apps or programs and focus on one thing at a time. This is the same for our brain. Now, what does counseling look like during remote learning? Think of the first session as a getting to know you session. It involves paperwork, questions from the counselor, and setting goals. During the first session, there wouldn't be any deep dive discussions and therapy as of yet. The preceding sessions are used towards the achievement of whatever goals you and your counselor have set during the initial appointment, whether it be decreased anxiety symptoms, better mood, or well-managed stress levels. The last appointment is when goals have already been met, or if you or your counselor feel that you might benefit by connecting with an off-campus provider for continuity of care. This is usually where planning is done for future care, and the counselor makes sure that you are well tucked in before they terminate the counseling sessions. Here are important campus resources that you should all know. The Counseling Center is open for a telehealth assessment, consultation, and support services from Monday to Friday, 8:30 to 5 p.m. The number to call is 619-260-4655. That is the same number to call for urgent concerns, but after dialing that number, make sure to press 1 so that you can talk to a counselor on call. You may web book a mental health appointment through My Wellness portal at mywellness.sandiego.edu. On this slide, you can also find a link for Silver Cloud, and you can sign up using this link. Please feel free to hit the pause button to get this important information. Here are additional information for other campus resources. The Disability and Learning Difference Center is open, and you may get more info at their website at sandiego.edu/disability. The Campus Assault Resources and Education is accessible 24/7, but please take note that this is a private and not a confidential resource. On this slide are phone numbers for the International Center and Public Safety. So please feel free to hit the pause button again to get these important numbers. Lastly, phone and video visits due to acute illness or injury can be scheduled at the Student Health Center. However, due to the current pandemic, do not walk into the Student Health Center without a medical provider scheduling you for an in-person appointment. For more information, call 619-260-2595 or visit their website at sandiego.edu/health-center. Please stay connected with student wellness. Explore the USD Student Wellness website at sandiego.edu/URUSD or follow us on Instagram at BeWellUSD. On behalf of the Office of International Students and Scholars and the University of San Diego Student Wellness, we hope that together we can stay safe and well through the current public health crisis. Thank you so much for your time.